am Dr. Syed Zahid Raza, consultant urologist at Koshys Hospital. As we all know that June is celebrated as National Men's Health Awareness Month. The purpose of this is simple, is to heighten the awareness of preventable diseases as well as to encourage early detection and treatment of such diseases. Now we at Koshys Hospital have decided to educate our patients about a terminology or a disease called an overactive bladder. Now what is an overactive bladder? Overactive bladder, also known as OAB, is when a patient has sudden and compelling urge to pass urine, which might be difficult to control and might also be associated with unintentional loss of urine. The other symptoms are the patient might need to go to the bathroom frequently, and also when the patient is asleep in the night, he might have to wake up quite regularly to pass urine, thereby disturbing the sleep. Now to understand what overactive bladder is, you have to understand the basic physiology of how a bladder works. For instance, now the urine is produced by the kidneys and is transported into the bladder through tubes called the ureter. Now the urine is stored in the bladder at a very low pressure until the bladder is filled with urine. Now once the bladder is completely filled to an extent where the patient has an urge to pass urine, there are signals which are sent to the brain, and the brain comprehends these signals, and once we, being social animals, identify a place suitable to pass urine, the brain sends back signals to the bladder, wherein the bladder contracts and simultaneous relaxation of the pelvic floor muscles and the sphincter occurs, thereby expelling the urine. Now any defect in this normal mechanisms wherein involuntary contractions of the bladder occur will result in an overactive bladder. Now what causes these involuntary contractions? Now there are multiple reasons why a patient can have these involuntary contractions resulting into overactive bladder. A few of the commonest causes are any neurological disorders like cerebrovascular accidents or strokes, any other neurological disorders like Parkinsonism or any age-related cognitive defects wherein people in elderly age group will have difficulty in comprehending the signals sent by the brain to the bladder and thereby having involuntary contractions. And other causes being diabetes. Diabetes can cause overactive bladder. Bladder irritants, that we consume bladder irritants on a regular basis in our regular diet, which we might not be aware of. For instance, tea and caffeine in coffee are bladder irritants. These can cause involuntary contractions. Alcohol and smoking are another few examples. Any colas, what we regularly take consume in our diet, those also will result in involuntary contractions. Other reasons for overactive bladder are diseases or conditions like urinary tract infections, any conditions which affect the bladder, for instance bladder stones, bladder tumors, any condition which will prevent the complete evacuation of urine from the bladder, like a bladder outlet obstruction, which is commonly seen in patients who have a prostate enlarged. And obesity. Obesity also is another important cause for overactive bladder. Now there are certain medications as well like diuretics which can cause overactive bladder. Now why is it important for us to know what is an overactive bladder? Because it has a social impact. Now what it causes is, it causes anxiety in patients, it causes stress in the patients, it causes less sleep because the patient has to keep waking up to pass urine. The patient also has loss or there is a difference in sexuality of the patient. So these effects will have a social impact on a patient, where the patient might think twice before traveling long distances. The patient might be not socially active. He might be confined to his workplace or house and not outgoing on a regular basis. Now, how to prevent these involuntary contractions or how to prevent overactive bladder is, first and foremost, we have to understand that we'll have to maintain a healthy weight. Obesity has a direct impact on overactive bladder. So thereby, if we maintain healthy weight, it does have a positive impact on preventing or keeping the overactive bladder under control. Treating chronic conditions and keeping them stable, the chronic conditions like diabetes, is also very essential. Third thing is diet. Diet is very important, as I have previously told that the bladder irritants which we consume on a regular basis in our day-to-day life, they have to be avoided. Important to note, what is to be avoided is coffee, which has caffeine, tea, smoking, alcohol. These things have to be avoided as much as possible. And another way of preventing and keeping overactive bladder under control is by having a healthy workout or a daily routine of exercise. It definitely helps in keeping the overactive bladder under control. Now, there are certain exercises which will strengthen the pelvic floor muscles, like the Kegels exercise. Those can be done to strengthen the pelvic floor muscles, which will help in trying to control the urge and reducing the involuntary or unintentional loss of urine. There are medications as well which will help in treating this particular disease complex. Like for instance, there are anticholinergics. Now there are newer medications which are beta-3 agonists. There are neuromodulation techniques which will help in keeping the overactive bladder under control. And as far as surgery is concerned, there is a particular surgery which can be done. This is only reserved for patients who are not compliant or in whom the medications have not worked. This is something called intravesical botulinum toxin injection, wherein the botulinum toxin is injected into the bladder, and this will help in relaxing the bladder, and the involuntary contractions are controlled up to a certain extent. And the flip side of this or the downside of this is that it is a temporary reversible of the involuntary contractions. It might have to be repeated quite often. So this is overactive bladder, which requires an early detection and it is preventable. So if you are facing any of the above symptoms, you might be having an overactive bladder. So my suggestion is to come meet us at Koshys Hospital and let us help you in preventing and treating this disease at the earliest. Thank you.